Reverse sneezing in dogs can sound like a dog is snorting, but AnimalWised explains what is really going on with the animal. What is reverse sneezing in dogs? Known scientifically as inspiratory paroxysmal respiration, reverse sneezing is a muscle spasm caused by a palatal or tracheal irritation. It results in violent inspirations of air which make it appear as if your dog can't stop sneezing. It is usually accompanied by snorting or honking noises as well as chest contractions. Despite seeming serious in the moment, it is relatively common and not usually dangerous for the dog. The breeds most likely to have reverse sneezing are brachycephalic dog breeds such as pugs or boxers. Reverse sneezing in dogs and vomiting. When dogs reverse sneeze, they may adopt a posture and make sounds that appear as if they are retching. This is to do with their gag reflex. It is not an upset stomach. The sneeze will not be accompanied by throwing up, but they may expel a little saliva, which is not to be confused with vomit or bile. Learn more about laboured breathing in dogs with the video we share above. Difference between reverse sneeze and tracheal collapse. Often confused with each other, the main difference is that reverse sneezing is not dangerous, but tracheal collapse is. The duration of reverse sneezing in dogs is shorter and does not result in serious consequences for the animal. Reverse sneezing sees a strong intake of air, but tracheal collapse usually produces a cough. A tracheal collapse is a partial or complete obstruction of the trachea. When it happens, the animal begins to present easily noticeable symptoms. They include whistling noises in the chest, difficulty breathing, coughing, and lethargy. Tracheal collapse can occur in different degrees. Some dogs will only need to take medication, but the most serious cases require surgical intervention. If tracheal collapse seems a possibility, you need to speak to a vet immediately. Causes of reverse sneezing in dogs. Although reverse sneezing is more common in brachycephalic breeds, it can occur in dogs with a longer nasal passage. In these cases, reverse sneezing is caused by a pharyngeal reflex or gag reflex. Some of the causes responsible for reverse sneezing are strong and penetrating odours, dust in the environment, aspiration of a foreign body such as a piece of grass, overexcitement and nervousness, a tug on the collar or leash. What should I do if my dog has reverse sneezing? If they suffer from reverse sneezing regularly, it will be advisable to go to the veterinarian to confirm diagnosis and rule out a more serious health problem. It is also important to rule it out as a symptom derived from an infection or another medical issue. A reverse sneezing episode should last no more than 1 to 2 minutes at most. They commonly only occur for a few seconds. After this time, the dog should return to normal. If this is not the case, we may be confusing the symptoms with another ailment. Home remedies for reverse sneezing in dogs. As it is a brief and harmless condition, it is not necessary to apply a remedy. However, you can help them in the moment by massaging their throat during sneezing, covering their nose for a very short time so they swallow saliva and relieve the irritation in their trachea, providing water if the sneezing is cyclical, blowing in their face gently but without overwhelming them. If you want to continue learning about dog diseases, don't miss the playlist we share here. Share your experiences with this symptom by leaving a comment below, and we'll see you next time.